Have you ever woken up and immediately felt the need to clear your throat? Not just once, but over and over again every single morning like clockwork? Maybe you've gotten so used to it that you barely notice anymore. You clear your throat, you swallow, you move on with your day. But here's the question most people never stop to ask: why is this happening in the first place? And more importantly, what is your body actually trying to tell you? Today we're going to talk about something that affects millions of adults, especially after the age of 50, but rarely gets the attention it deserves. That constant feeling of mucus sitting in the back of your throat, that urge to clear it, swallow it, or cough it up. Doctors have a name for this sensation, and they see it constantly, but most patients never get a clear explanation of what's really going on. By the end of this video, you'll understand the real causes behind this surprisingly common issue, when it's simply a nuisance, and when it might be worth a closer look from your doctor. So stick with us, because one of the causes we'll cover later is something almost nobody thinks to ask their doctor about, and it could be sitting right in your kitchen cabinet. Let's start with the basics, because understanding what's actually happening in your throat makes everything else easier to follow. Your nose and throat are lined with a thin, moist layer of tissue that constantly produces mucus. This isn't a malfunction, it's completely normal. In fact, your body produces somewhere around 1 to 1.5 liters of mucus every single day, even when you're perfectly healthy. Most of the time, you don't notice it because it flows quietly down the back of your throat and gets swallowed without you ever being aware of it. Think of it like a security system for your airways. This mucus traps dust, bacteria, allergens, and other particles before they can reach your lungs, then carries them down into your stomach, where stomach acid neutralizes them. So if mucus production is normal and happens constantly, why do some people suddenly feel like they're drowning in it while others never notice it at all? The answer usually comes down to one of a few things. Either your body is producing more mucus than usual, the mucus has become thicker and harder to swallow without noticing, or the muscles and nerves involved in clearing your throat aren't working quite as smoothly as they used to. Let's walk through the most common reasons this happens, starting with the one most people already suspect. The first and most common cause is something called postnasal drip. This happens when your nose and sinuses produce more mucus than normal, and instead of draining forward out of your nose, it drains backward down your throat. You can think of it like a sink with a slow drain. Normally, everything flows through smoothly and you never think about it. But if something is irritating your nasal passages, whether that's allergies, dry air, or a sinus issue, the sink starts backing up and that extra mucus has nowhere to go but down your throat. This is incredibly common in older adults, partly because as we age, the tissues in our nose and throat naturally become a bit drier and less elastic, which can actually make mucus feel thicker and stickier even when your body isn't producing more of it than usual. Allergies are one of the biggest drivers of postnasal drip. And here's something that surprises a lot of people. You don't have to have classic allergy symptoms like sneezing or itchy eyes to have an allergic reaction happening in your nose. Some people only experience that constant throat-clearing sensation with none of the other obvious signs. Common triggers include dust mites in bedding, pet dander, mold in damp areas of the house, and seasonal pollen. If you notice the mucus feeling worse at certain times of year or worse in certain rooms of your home, that's often a strong clue that allergies are playing a role. But allergies aren't the only thing that can irritate your nasal passages and trigger this kind of mucus buildup. Dry indoor air, especially during winter months when heating systems run constantly, can dry out the lining of your nose and throat, which paradoxically causes your body to produce thicker, stickier mucus as a kind of defense mechanism. It's your body trying to protect tissue that's become irritated and dehydrated. This is one of the simplest issues to address, and we'll get to some practical solutions for it shortly. Now, here's where we get into something a little less commonly discussed, and this is the surprising one we mentioned earlier. Acid reflux, sometimes called GERD, can be a major hidden cause of that throat clearing sensation, and many people have no idea their throat symptoms are connected to their stomach at all. When stomach acid travels up the esophagus, sometimes it reaches all the way up to the throat and even the back of the nasal passages. This is sometimes called silent reflux because, unlike typical heartburn, it doesn't always come with a burning sensation in the chest. Instead, the only symptom might be that persistent persistent feeling of mucus or a lump in the throat, frequent throat clearing, or even a mild hoarseness in the voice, especially in the morning, this connection surprises a lot of people because we tend to separate digestive issues from throat and sinus issues in our minds, but the body doesn't work in such neat separate categories. If you've ever noticed that your throat clearing is worse after eating certain foods, after lying down too soon after a meal, or first thing in the morning after a night of sleeping, silent reflux could very well be part of the picture. Common triggers include spicy foods, caffeine, alcohol, citrus, and eating large meals late in the evening. Let's talk about another factor that doesn't get nearly enough attention, and that's hydration. As we get older, our sense of thirst naturally becomes less reliable. Many older adults simply don't feel as thirsty as they used to, even when their body genuinely needs more fluids. This can lead to a kind of low-grade chronic dehydration that most people don't even realize is happening. And here's the connection to your throat. When your body doesn't have enough fluid, mucus becomes thicker and stickier, which makes it much harder to swallow comfortably. Instead of flowing smoothly and unnoticed down the back of your throat the way it's supposed to, it sits there feeling heavy and irritating, prompting you to clear your throat again and again throughout the day. This is actually one of the easiest causes to test for yourself. If you've been drinking mostly coffee, tea, or just very little fluid throughout the day, try increasing your plain water intake for a week and pay attention to whether that throat clearing habit starts to ease up. It's a simple experiment, but for some people it makes a surprisingly noticeable difference. Medications are another piece of this puzzle that often gets overlooked, especially for adults taking multiple prescriptions, which becomes more common as we get older. Certain blood pressure medications, particularly a class called ACE inhibitors, are well known to cause a dry, irritating cough and a sensation of throat tickling or excess mucus in some people. Antihistamines, while they can help with allergies, can also dry out your mucous membranes too much, which paradoxically leads your body to overcompensate by producing thicker mucus. Even something as simple as a diuretic, often prescribed for blood pressure or fluid retention, can contribute to overall dehydration, which circles back to that thick mucus problem we just talked about. If you've started a new medication around the same time your throat symptoms began, that timing is worth paying attention to. This doesn't mean you should stop taking any prescribed medication on your own. That decision should always be made with your doctor. But it's absolutely worth mentioning to your physician or pharmacist because sometimes a simple adjustment or alternative medication can make a real difference. Now let's talk about something that becomes more relevant the older we get, and that's how the muscles involved in swallowing change over time. Swallowing isn't as simple as it seems. It actually involves a coordinated effort between dozens of muscles in your throat, and like any muscle group in the body, these can gradually lose some strength and coordination with age, a process sometimes related to general muscle loss throughout the body. When the swallowing muscles aren't working quite as efficiently as they used to, mucus and saliva can linger in the throat a bit longer instead of being cleared smoothly, which creates that sensation of needing to clear your throat more frequently. This is usually a gradual process and for most people a mild and manageable one. But if you've noticed that alongside throat clearing, you're also having any difficulty swallowing food or liquids, a sensation of food getting stuck, or unexpected weight loss, those are signs that deserve a conversation with your doctor, since they can sometimes point to something that needs more direct evaluation. There's also a connection worth mentioning between throat mucus and the air you breathe at night. Many people who feel like they're constantly dealing with mucus, especially first thing in the morning, are actually dealing with mouth breathing during sleep, which can sometimes be related to nasal congestion or even sleep apnea. When you breathe through your mouth instead of your nose overnight, the air isn't filtered and humidified the way it normally would be, which can dry out your throat and lead to that thick, sticky feeling when you wake up. If you frequently wake up with a dry mouth, a sore throat, or notice that a partner mentions you snore, it may be worth discussing your sleep with your doctor, since addressing nasal congestion or sleep quality can sometimes improve that morning throat clearing significantly. So now that we've covered the most common reasons behind that persistent throat clearing feeling, let's talk about what you can actually do about it. The good news is that for the vast majority of people, this is a manageable issue, not a dangerous one, and many of the solutions are simple lifestyle adjustments rather than anything complicated. The first and easiest place to start is hydration. Aim to drink water consistently throughout the day rather than all at once. Keeping a water bottle nearby as a visual reminder can help, since thirst alone isn't always a reliable signal as we get older. Herbal teas and broths count toward your fluid intake as well, and warm liquids in particular can help loosen thick mucus and make it easier to clear comfortably. Next, take a look at the air in your home, especially your bedroom. If you live somewhere with dry heating in the winter or generally low humidity, a simple humidifier can make a meaningful difference by keeping the lining of your nose and throat from drying out overnight. Just be sure to clean it regularly, since humidifiers can become a breeding ground for mold and bacteria if neglected, which would only add to the problem rather than solve it. If allergies seem to be playing a role, try to identify and reduce your exposure to common triggers. Washing bedding in hot water weekly, using allergen-proof pillow and mattress covers, and keeping pets out of the bedroom can all help reduce nighttime exposure to dust mites and dander, which are two of the most common indoor allergy triggers. If silent reflux seems like a likely contributor, especially if your symptoms are worse in the morning or after meals, there are some simple habits worth trying. Avoid eating within 2 to 3 hours of lying down or going to bed. Try elevating the head of your bed slightly, even a few inches can help prevent stomach acid from traveling upward while you sleep. And pay attention to whether your symptoms ease up when you reduce common triggers like caffeine, alcohol, spicy food, or large late meals. Saline nasal rinses are another simple and well-established tool that many doctors recommend. They help flush out excess mucus, allergens, and irritants directly from the nasal passages, which can reduce the amount of postnasal drip reaching your throat. They're inexpensive, available at most pharmacies, and many people find noticeable relief within just a few days of consistent use. And finally, pay attention to your medications, not by stopping anything on your own, but by bringing up your symptoms at your next doctor's appointment or pharmacy visit. Simply asking, could any of my current medications be contributing to this, opens the door to a conversation that might lead to a helpful adjustment. Now, while most cases of persistent throat mucus are nothing more than an annoying but harmless issue, there are a few signs that genuinely deserve a conversation with your doctor rather than just home remedies. If you notice blood in the mucus, unexplained weight loss, persistent hoarseness lasting more than a few weeks, difficulty swallowing, or if the throat clearing is accompanied by ongoing pain, these are worth having properly evaluated. This isn't meant to alarm you. In the vast majority of cases, the explanation turns out to be something straightforward and very treatable. But getting it checked simply gives you peace of mind, and peace of mind is worth a great deal. Let's bring this all together. That persistent feeling of mucus in your throat is rarely caused by just one single thing. More often, it's a combination of factors working together. Maybe it's a bit of seasonal allergies combined with dry winter air. Maybe it's mild dehydration paired with a blood pressure medication you've been taking for years without ever connecting it to your throat. Maybe it's a touch of silent reflux you never even realized you had because it never came with the classic heartburn symptoms you were watching for. The encouraging part is that once you understand the most likely causes, the solutions are almost always simple, practical, and well within your control. Staying hydrated, managing allergens in your home, paying attention to what and when you eat, keeping the air in your bedroom from getting too dry, and having an open conversation with your doctor about your medications can address the vast majority of cases. You don't need anything complicated or expensive to start feeling better. You just need to understand what's actually happening, which is exactly what we've covered today. If anything in this video resonated with you, we'd genuinely love to hear from you. Which cause surprised you the most? Was it the connection to acid reflux, the role of dehydration, or maybe a medication you never realized could be contributing? Let us know in the comments, and feel free to share your age and where you're watching from. This community is full of people going through the exact same things you are, and your experience might be exactly what helps someone else finally understand what's been going on with their own throat. Thank you for spending this time with us today. Take care of yourself, stay hydrated, and we'll see you in the next video.